What made you become a PT? And we can go from there.
Yeah, Mike, thanks for having me. My name is Tyler Soltis. I'm a physical therapist here in the Nashville, Tennessee area. Went to school together with Mike. That's how we met. Go Bulls. And I guess what got me interested in PT is kind of a multitude of a story, but I really didn't know what PT was until I was in college. I started out as a pharmacy major and partied too much, didn't get the grades I needed, and decided I needed to find another avenue. So exercise sciences fell into my lap. Exercise has been something that's been a part of my life and with sports and just being active. So took that as my career path and snuck into PT school and been riding the wave ever since.
You were a football player, right?
Football, wrestling, track, kind of just a little bit of everything. Just your average at every sport. Not good
Yeah.
at much, but enjoyed playing them all. And it's I think playing sports and being on a team really kind of helps you develop your personality and who you are. So that was probably a big part of what pushed me towards PT.
And was exercise science, as soon as you started classes, was initially like, okay, I definitely just want to become PT, or did you have other options as well?
I had a lot of other options just because I didn't feel I had the grades to get into PT school. When I switched, I knew it was like really competitive. Wasn't sure about retaking classes. I ended up actually doing a fifth year to kind of make up for some of those gen ed classes. And at the time, I got waitlisted for PT school, so I was kind of like, should I go, into exercise physiology? Should I try to get my master's in public health? Thought about going the military route for a while. So uh, I had a lot of avenues while I was waiting to get into PT school. So being on the wait list from February until July, I had like 10 different paths I thought I would go down, but luckily got into PT school and that's where life took me.
Yeah, and it's interesting because exercise science is so broad. I feel like a lot of the time when people say, "Oh, I got an exercise science bachelor's degree," it's kind of like saying you got a bio degree, and it's kind of very general until you can kind of decide what you want to do.
Right, exactly. As soon as you get that exercise science degree, it's kind of like, all right, what do I do now? I spent thousands of dollars over 4 or 5 years to get this bachelor's degree, and there's really no set career. I guess you could go, personal training, you can go master's degree. There's a lot of different routes to take. It's just you got to find your best fit.
Yeah, so we had gone through it. We know we both gotten through PT school and got into there. For those that don't know, what's the typical process? What does it take to get into PT school, really, and what goes into it?
I guess it's different at every school. Coming from a state school up in New York, the process was a couple of years of exercise science. You get the prereqs, and PT school is quite competitive. I had no idea that, you needed at least above a 3.5, and most people get even higher than that just to get into PT school for a GPA. So, going through those anatomy, physiology prereqs, taking the gross anatomy lab over summer, which is, intensive, but you learn a lot. Um, I wouldn't say it's an easy path, but it's enjoyable if that's your niche.
Yeah, and definitely we had a lot. I had a lot. There was a lot of people in our class that kind of were doing other stuff too at the time. I remember one of our friends; she was doing swimming at the time, and several kids, even Frankie, did track and other amongst other things during the time. So allowed for people to kind of do many things at the same time.
Yeah, I think that was, definitely a good plus of PT school. Once you got in, is, classes were scheduled so that you could have, play a sport on the side. Or I worked as a PT tech all 3 years of grad school. So you're able to, if you can keep a balanced schedule, I think it's actually harder to get in than to stay in PT school.
For sure. Yeah. Well, there were, yeah, definitely easier to stay in than get out. But what did you have any mentors, anybody who like maybe push you towards physical therapy?
I would say, I guess it would be more my friend group at the time pushed me towards it. But I did have a great mentor, Brian Brada. He was the director of sports medicine at University at Buffalo, and just by chance got to do a exercise science internship with him, and he taught me a lot in the athletic training field, and it really kind of sparked my interest more into PT. Seeing the rehab side of things with the D1 athletes at Buffalo, and working with volleyball, wrestling, women's basketball, just seeing all different sorts of injuries, and give all the credit to those athletic trainers. They're on the front lines, making a quick assessment, diagnosis, treatment, and they're doing the day in and day out grind with those athletes. And I think I almost went that route as well, but PT felt a little bit more natural to me than the athletic training, I guess.
Yeah, likewise. I did when I started off at school to become an engineer, and then I switched to sports medicine, and that was kind of leading down a path of athletic training. And I got on the field a little bit, and it was nice, but it wasn't. Not that it wasn't challenging; it's certainly very challenging. But I felt like there was more to PT than athletic training and strength coaching had led on, and ultimately led my route down PT. And maybe your own definition, what would you say the biggest difference between those are, like a strength coach, an athletic trainer, and then like a physical therapist?
Ooh, that's a great question. I mean, we all overlap so much in what we do. Um, you know, from the strength and conditioning side of things, you're definitely, more into the programming, the nutrition, what the athletes' schedules are. Your schedule's going to be crazy, waking up early hours to get those morning workouts in, and the middle of your day is your downtime to have life, see your family and stuff. And then at the end of the day, you go back. So it's a real big difference in the schedules. For same thing with athletic training. They're first thing in the morning, they're treating the athletes, they're prepping the fields, and the middle of the day is kind of their downtime until the athletes are ready for game time or a practice. And so you got a really long day in those two career fields when it comes to lifestyle. Whereas PT, if you're on the sports side of things, you can certainly have that schedule as well. But for the most part, we work the 9 to 5s, or we flex our schedules a little bit based on patient needs. But we just have a little bit more of a balance, work-life balance in that sense. And from the diagnosis, treatment, assessment, we all do things a little bit differently. We're all looking for different aspects of our profession. So I mean, we all work together, but we're so different in how we work with an individual.
Yeah, and I think a good point of that would definitely be just like athletic trainers and strength and conditioning coach. It's just straight up athletes, and it's whatever the athletes wants. I mean, it's just everything goes towards like getting the athlete to perform at their best. And strength coaching is definitely maximizing peak performance, I would say. Athletic training is like perhaps crutching along to get you to continue through a season. And then PT, I feel like, is like almost the off time from the season to get you like completely back, because with PTs, we have this whole rehab process where you start from day one and we get you to a certain goal. Where athletic training, you may be taping, or it may be modification, or it may be and maybe another athletic trainer could speak more on this than I could, but I feel like the biggest discernible difference is getting some of the ground zero stuff, especially with like post surgical implications. It's certainly PTs serve a bigger role in that realm versus where athletic training and strength and conditioning coach may be just like getting the athletes over the hurdle just to continue playing and get them back in the game.
Yeah, I'd 100% agree with that. And then, with the athletic training too, getting those mid-season operations where they can, take 2 weeks off and get back on the field. That's the athletic trainers running that rehab process under the surgeon's directive. Is they're trying to condense, a 6-week PT program into 2 weeks and get this athlete back on the field, get them to perform and be at their highest level they can be. And with that, being able to educate the athlete, I think, is a huge challenge, just to let them know, this is, you're not fully healed at this time. You can play, you can go, a certain percentage, but you got to listen to your body so you don't make things worse. And that's that balance of educating the athlete. Is it worth it to push through now, and finish out your season, or do you just stop now and rest up for the next year and try to perform at a higher level next year? And there's a lot more at stake decisions, I think, from a strength and conditioning coach and athletic training than, say, PT. We're not really in any rush usually, unless we're working with an athlete or something, but for the most part, we have time on our side.
Yeah. And when you were working in, I don't know if you felt the same, because I think at times I felt this way when I worked in the athletic training clinic. I felt like I didn't have that education piece, and I wasn't able to describe perhaps timeframes for rehab, or just give a good answer, so to speak. Did you feel the same way when you were working with athletes?
Yeah, I think it's very vague. It's very individualized. I think it's just really clinicians expertise at that point. There's no sound research. Every athlete's going to present a little bit different, have a different drive, different time of the season that they're injured, or uh, yeah, it's a very vague question to answer and education piece to give when everyone's kind of their own piece of the puzzle.
Yeah. So getting back into, PT, when you got through PT school and first started, what were your interests? Did you originally know that you wanted to get into orthopedics, working in a clinic where you are now, or were your interests somewhere else?
I really didn't know at the time when I first got in. Kind of always thought, orthopedics or something maybe neuro related. I had some experience uh, working with neuro patients, and after my first rotation working in an acute care setting for 8 weeks in a neuro ICU, that really opened my eyes to. I thought I wanted to do acute care the rest of my life after that first rotation, and as PT school kind of tumbles on and you learn more and get more experience, ortho just kind of took me by that path and led me to where I am now. So
Yeah, and for those that don't know, during PT school, which is the graduate school portion of the physical therapy program, we do multiple rotations, and we have to do. One of the rules is, at least at Buffalo, you had to do an acute, which is a hospital, a subacute, which is generally like a nursing home, and then you had to do at least one outpatient. And then after that, you can kind of specialize and do whatever you want, but we had to kind of at least get a generalization of places to work, so that way we have a good handle on everything, and then once you've done all of them, then you can kind of choose which one you want.
yeah,
and
exactly.
and you said you worked with neuro. What was there something that made you switch to ortho after working with acute for so long, or is it just kind of like, okay, this is what I want to do now?
To be honest, I followed the money,
Yeah.
and being for everybody else to know, Western New York is not the place to be if you're a PT that needs to pay off student loans. It's just not the best reimbursement rates, and you got to see a lot of patients if in ortho and acute, no matter where you are. So, fortunately, through our advisors, through some of our mentors, I did one of my clinical internships down here in Tennessee, and had a great experience. Learned a lot of manual therapy, and ultimately led me to the company I'm with now. And also the pay wasn't as bad, wasn't so bad moving down this way compared to upstate New York.
Yeah, do you think, in your own words, do you think it was worth it to go into that much debt? I mean, it's we always talk about, I think people always talk about like the student debt crisis and everything, and everyone's always like, well, people are putting themselves in thousands of dollars worth of debt for like an English degree, but like we went to school and we put ourselves in thousands of dollars worth of debt, and we got a doctorate, and we still are having difficulties with that. And so maybe you can speak on your own experience, and like, I guess, what kind of toll it took on you taking on the debt and then trying to find a job after PT school.
Well, that is a loaded question. I'll try not to go down too many rabbit holes with
No,
student
please
loans
do.
and and interest rates and everything. But yeah, I mean, I paid for, my parents helped me out where they could, but all 8 years of my schooling, from 5 years undergrad and 3 years of PT school, was all loans, federal and private. And so, coming out well over $200,000 in debt, and you look at your starting salary is, in Western New York might be $55,000. That's going to take you 20 years to pay off and then some, based on the, 6 to 8% interest rates that federal loans are going at. So it was, at the time, I guess I wasn't really super educated on, like, taking out loans and what the future costs would hold. I just was like, I got to get a degree. I got to find a job and pay these off. Excuse me. And yeah, I mean, it's I would say it's worth it now. Probably, when I first got out of PT school, I was like, oh my God, this is brutal.
Hmm.
But you live life and you enjoy it, and you try to just make it another monthly payment. And at the end of the day, you can't go back and change it. And so I'm doing what I love to do. And hopefully, one of my things I want to get into is just really getting, at the Capitol Hills and advocating for, PTs to get reimbursed more, to pay us a little bit more. when we can prove that we're saving, thousands of dollars in medications and surgeries and changing people's lives to get them back to work and make them, a productive member of society again. And I think at the end of the day, we really do, at this point in time, our services are very undervalued. And I think that undervalues our degree. And so it's tough to look out as a young, undergrad and look at the PT debt to income ratio. But if you want to do it, I say absolutely go for it. I don't regret a single day of taking out every one of those loans. It's just another bill to pay each month.
Yeah, it's really tough. I mean, the amount of times I get like a eval and treat from a family physician, and then like they don't really have any idea what's going on. It's kind of very surprising, to be honest with you. And the fact that they got billed however much they got billed, and then we get paid way less. It's kind of it always blows my mind. And it's like, okay, well, this is, my doctor has no idea what's going on. Maybe you can help. I don't know. And so then you provide them a solution, and you're like, oh, well, why didn't I come and see you before? Well, I don't know. It's a great question. And
Yeah,
definitely, I think advocating needs to be like more people need to know about what PTs do.
absolutely. I mean, what are you doing out west your podcast is a great platform for it, but is there anything that you're doing in your community or with your patients to try to advocate, say, hey, next time you're in this situation, or next time you have a friend or family member that's kind of thinking, I got this injury, what should I do? Or what are you kind of doing to pass the word?
Yeah, it's been a lot easier now bringing it up now that I have the podcast, just to say like what my mission is with the podcast, and also like we can get on the topic of PT, but the biggest thing I try to do is tell people like don't always go to your family doctor first. If something hurts, just go see a PT, and tell your friends that, tell your family that, and by and large, I mean, word of mouth is usually the best means of travel, and obviously social media is one of is the new age version of doing that. But the best version of what I've tried to do is to just tell as many people as I possibly can, and just show them like, hey, I have some answers, and if I don't know the answer, I'm going to refer you out. And being open early on and getting people to trust you, I think has been really important and really helpful for me in that regard, because sometimes I don't have all the answers, and I'm completely okay with that. And when you start to fake it, people can tell. Like people know when you're bullshitting. And if you just say like, well, maybe it's this, maybe it's that, it's like, okay, well, do you know or do you not know? And if you don't, then that like people are coming to pay a service for you. So I guess to answer your question, the biggest thing I try to do is just tell as many people as I can, and then, you know, try to utilize the tools that I got with the podcast, and hopefully, as I get better with social media, try to get the word out there and tell more people that like, you don't need to go see a family medicine doctor right off the bat. You can go see PT, and if that doesn't work, then we'll send you to a doctor. Is that the
Mhm.
same for you?
Yeah, pretty similar, and just trying to advocate for the direct access. Tennessee's actually got great laws for it. I mean, they just passed it last year that we can treat patients for up to 90 days or 3 months without a physician referral, which is huge. And also, I think, not only building that relationship with your patients and those members of the community, but building that relationship with your primary care providers, with your orthopedics, and all your referral sources that you connect with. I think it's important that we make good relationships with them. I've had a lot of direct access patients, that are moving to this area. Tennessee is kind of a hot button state right now for people to be moving towards, and a lot of my direct access patients coming to PT don't have a primary care. So having that go to doc or two that you have in your area, and luckily where my clinic is right next door, we have a internal med primary care office that I've been able to develop some relationships with, and would certainly send any one of my patients to them. So I think as PTs, we're pretty good at building relationships, getting out in the community, staying active, and passing the word there, but also to other healthcare providers is huge too.
Yeah, that's definitely something that I should try and work on more, is talking to other physicians. I've had conversations with a couple of them, especially ortho surgeons, that I don't know in the area, but having them know my name, or at least other people knowing that you're in the area and you have these interests, I think it's a great idea. And California has direct access, so you can see a PT for up to 10 visits or up to 45 days before you need a physician to sign off on your plan of care.
Very nice.
Yeah, so that's been nice.
Yeah.
I've had a couple of those, and thankfully out here in the Bay Area, people are they are some of them are better off and able to pay out of pocket too for some cash payments as well. So it makes it easier in that regard. But yeah, definitely talking to physicians is huge, and communicating to other people in the area is really important. And that's something that we kind of lack too. I think at least we didn't really talk about that in PT school at all, where you're like, hey, you should really call your local physician or local doctor's office and, create a relationship with them.
Yeah. That's the first thing I did when I moved here. Was when I started practicing. I moved here and didn't have a primary care for myself. So when I was at the first clinic I worked at, getting a bunch of referrals from a certain physician. So I called them up and I said, hey, I need a primary care myself. And it was a great experience going there to, not only get myself blood work and all that checked out, but to chat with him, see what his assessment is like. Uh, Also got to sit there a little bit longer with him and just see, like, what do you do if a patient comes in for shoulder pain? What's your go-to assessment? Are you doing any special tests? Are you doing any neuro screens, cervical screens, anything like that? And be surprised. Like, I was surprised actually. A lot of PAs and local primary cares are all for doing that, and if they don't know, they send them to PT, which is also really promising to hear that they're kind of trusting us with their patients and not just sending them straight to ortho.
Yeah, absolutely. I mean, I think there's a big jump between a PA assessment and then a orthopedic assessment through a physical therapist, and then a full blown ortho surgeon assessment. And I think they're completely different than, a family medicine doctor, a PA, and etc.
Yep,
And
I absolutely.
and for since you've been working um, at your new clinic, what has it been like working as a boss? I mean, essentially, you're running the clinic now, and how has it been being a boss now that you're out a couple years and you've been working in the space?
It certainly had its challenges. I only worked for a little over a year before I applied for the clinic director position of opening a brand new clinic, and we opened a brand new clinic during back in September of 2020, kind of during the pandemic, and not only going for to build the relationships with the patients and all the new referral sources, and really, I think my clinical skills were pretty good at the time to get me to where I needed to be, but my business marketing, relationship management with the referral sources, and just getting out in the community was definitely a little bit more time consuming than I had anticipated. So when you're opening a new clinic, whether it's under a corporate umbrella or it's your own private pay clinic, it's just kind of be prepared to be working on that 24/7 on call. And as a leader in the clinic right now, it's it was just a one PT clinic. We're slowly becoming. I just have a PRN PT working with me now, getting ready to hire our second full time, and have a front office manager, what we call patient support leads at our company. And early on, I didn't get a chance to hire my first PSL, and things didn't work out, and I had to fire my first employee. And so that faced many challenges too, and it was really tough to do. I had a lot of good mentorship and leadership above me, and I think the biggest thing going into it was I just asked a lot of questions. And if you don't know, you got to ask, because it's there's no room for error when you're opening a brand new clinic, and every week counts, every visit counts, every referral, every patient that walks through the door. It's like you treat them the best you can, because you want them to refer their family members, their friends to you, and to help grow the business and let them know you're in the community and there to serve. So it's had its challenges and a lot of ups and downs, but the best thing I've probably done for myself is just ask a lot of questions. Going into the new hiring process was a total new learning curve, having to be on the other side of the interviews and asking the questions and learning all the HR do's and don'ts, what you can ask, what you can't ask. And I guess as a young PT, 1 year out, these aren't the things you really think about on a day to day. You're still thinking about what special tests did I need to do for that knee earlier, and what was that range of motion on that patient before they left, and just trying to get your notes done. And so when you take on that next step of running a clinic, it's all that plus the management side of things. That in PT school, I mean, we had a little bit of business management, but
Not that
nothing.
much.
Yeah, maybe all a few hours, but It's just to learn as you go. I think that's where the best leaders learn, is from having mentors and asking questions. And thankfully, I've had a lot of good people around me to help support me and to get me to where I am, and learning every day. Every day there's something new, whether it's with the budget sheet, or a HR issue, or patient complaint about something, or you know what I mean. It's just, there's always something that you can learn from, and just trying to gather all the experience that I can.
Yeah, and I think you downplay it. I mean, for everyone listening, Tyler's a super smart guy, and he's can balance a lot of things all at once. And I think for you, obviously, learning as you go is not an uncommon term. But in your own reflection, I think, has there anything that's come up in your own mind, or maybe something that's the job has unveiled to you that you didn't really know about yourself that you kind of know now? Like, oh man, I didn't know I did that.
Yeah, I guess, I mean, one of the cool things that my company does when we get promoted into a clinic director position or any leadership position is a strength finders exam.
Mm.
And so you sit down and you do one of the whole, strength finders score, or not score points, that's a study guide, but strength finders assessment. And you kind of, feel what your strengths are, and then, compare them to, say, my patient support lead, and see what her strengths are and where we match up, and what the biggest thing I learned about myself that I kind of started to realize in PT school, and even as I got into the career, is I try to put too much on my plate. I wasn't very good at delegating. You do task A, I'll do task B. Instead of, it was, I'll take all of it, and then we can just kind of share our information at the end. And just being able to trust another individual that they're going to show up on time, get the work done. Check the patients in, walk them through the door, and be there. I think that you learn a lot about your personality types and what's good for you and what might be slowing you down. And I think one of the things that was slowing me down was I was just trying to do too much.
Mm.
And
And
so being able to, sorry,
I
go
was
ahead.
gonna say, how'd you combat that? How did you start just like throwing tasks? All right, you do that, you do that.
Yeah, just kind of practice as you go. And my mentor, she really helped me set goals. So being able to sit down and have month-to-month meetings with my boss, and her saying, okay, here's your 2-week goal, let's write this down, I'm going to check back in with you in 2 weeks, and I want objective data of what you did and why you did it. And it's kind of just like what we do as PTs, right? A patient walks through the door, we take our objective measures, and we set goals. And I think kind of thinking of it that way, in terms of leadership, in terms of delegating tasks, in terms of asking for help, it's write it down, set a goal, check back in with yourself, and have someone hold you accountable. And that's where I've learned a lot, just being able to have someone hold me accountable to say, all right, I need you to do this, and this is what you need to ask person A or person B to do. And if they don't get it done, then you address that. And so then having those one-on-one meetings with my employees and my teammates, and just saying, okay, this is what we aimed for, this is where we hit, this is where we fell short, what can we do better next time? And always having that, just like we do in PT, test it, treat it, retest it. And that's
Yeah.
what kind of the best leadership skills I've learned is, have a plan, put it in motion, what'd you do at the end?
Have
And
you have you always been like this, or is it just something that you picked up more recently?
I guess I've always had a little bit of that, like to what I do with like studying and things like that. But definitely in the past, 6 months, 8 months of being a clinic director, I've utilized those skills a lot more.
I swear every time I saw you in PT school, you had like a plan, or at least a list of something that you had going on ready to go.
Yeah, I've always kind of been like a big numbers guy and visual objective stuff right in front of me. So I think that was probably part of it. I like the planning, the organization part, but sometimes the execution is, that's the toughest part. It's all good and dandy to write these things down and be good at planning it, but if you don't execute, then it means nothing.
Yeah,
And
and for your who do you have working underneath you right now? Is it are you have PTAs, and
um,
you said you have the part-time physical therapist too, right?
yep. So right now my team is, I have my patient support lead, and I consider her, she's like the front office manager. That's her wheelhouse. She controls everything from the front door to the desk, the insurance. I'm asking her questions most of the time on all that side of the PT aspect. And then I have, right now we have just PRN staff like 2 to 3 days a week. So I'm trying to utilize PRN to build a full caseload. And with that PRN, we have a couple PTs and a PTA. So on any given day, I'll have, another license in the clinic with me that can, if it's a PT, I can have them do evals and, cosign notes, things like that. PTA, help them with the, get them the daily visits, and everybody that, works for us is, an A+ player. So I've had the opportunity to work with a lot of new faces in the past few months, having different PRNs come in, and all of them have been great, and just transitioning to a good setup to hire a full-time PT this summer.
Yeah, and you've been setting goals for yourself and trying to, you've had your mentor helping you along. Do you set goals for your employees as well? Is that kind of something that you like to build in, and do you talk to your employees about that?
Yep. So we do pretty much monthly clinic meetings, even though there's just the two of us, we still have it. Every week we do a weekly schedule for success, where we just make sure we have, for the next week, we have a good, flow of the day, making sure, if there's a patient that needs to be single booked, they're single book. If we can co-book, where are we going to put a new eval? So, I mean, we have our weekly meetings for scheduling for success and, flow of the clinic, monthly meetings to, reflect on our past month. Okay, which goals did we hit as a clinic? And then kind of one of the things I like to do is each of us have a personal goal. And it could be, this month I want to cook for myself twice a night, or this month I want to, walk a mile a day, something like that. So we've been trying to do little goals like that to just build a better relationship. And then we have quarterly check-ins too. So each quarter we just always want to reflect back on, how we're doing, where we're headed, what the year's been like, where we can improve, what we're excelling at. So I think that's one of the best things that we do as a company, is having so much time dedicated towards building relationships with your team and making sure we're all on the same page, and we're all always, striving to be better that next day, the next week, versus just kind of getting complacent.
Yeah, and Tyler's painting a really good picture of how clinics should be run, essentially. And unfortunately, not all PT clinics are run this way, and not everyone's are setting goals and want to be better and get out in the community and spread the word. So maybe if you're with a PT right now and you don't feel like they're doing a good job, always feel free to reach out to somebody else who may have these kind of actions, or at least mindset, such as Tyler does. Because again, I've, like any profession, there's good PTs, and there's definitely some bad PTs out there who may not be as passionate, or at least willing to put in the work to make sure that you're doing and your employees are doing better.
Yeah, and that's part of what brought me down here, was just the company that I had the opportunity to work with as a student. Really set the bar high for, who I wanted to work with, and what I wanted out of my work life. And there's certain clinics in the PT world that kind of give us a bad rep. And those PT mills where you go in and there's, a couple PTs, a ton of PTAs, a ton of techs, and they're seeing anywhere from 30 to 40 patients a day, and not getting a lot of one-on-one time with your therapist. And it's really just a lot of exercise. And those, I mean, and no shame against that. I've worked in those clinics as a tech, and people still get better. Patients get better. They may not get better as fast as they want to, or may not get the education piece that they need, just because there's not the available time to have with a doctor of physical therapy. But what brought me down here was the clinic flow, and having a quota of 10 to 12 patients a day, getting at least 45 minutes to an hour of one-on-one time. And the company that I'm with is really big on manual therapy, in conjunction with all our other modalities. So we guarantee our patients, our providers, our referral sources, our physicians, that, hey, every patient you send to us, we're going to get our hands on them. We're going to work some manual therapy, work some joint mobilization, soft tissue work, help them decrease pain, show them how to move properly. And I think that goes a long way with building a relationship with the patient, is being able to have physical therapy, just like one of our professors always said, neuro is a hands-on profession. So ortho, cardio, everything that a PT does there should always be some type of hands-on component. That's what our training is in, and that's where I believe we excel. And that's what brought me down here. And I think that's why our clinics have such great success, is because people value those services versus just going in and saying, go get on the bike for 10 15 minutes, do your 3 sets of 10 of clamshells, your squats, some pelvic tilts, up here's a cold pack, and now you're out of here 45 minutes later. And again, sometimes that PT works, and there's no shame in that game, but I think having the one-on-one time and being able to, when you have your hands on patients, you can have that time to talk to them, educate them what you're doing, why you're doing it, what they can work on. And I hope that the whole PT profession across the states heads in that direction, and that's certainly our goal here in Tennessee.
Yeah. And the other thing too is sometimes it's not even a product of how the clinic is run because of um, whoever's the boss or the owner of that clinic. It may just be a byproduct of the system, like we've talked about before in Buffalo. The reimbursement rate, or for people that don't know or aren't in the profession, when we provide a service based on where you are in the country, you get a certain amount back. And so in Western New York, we generally get a lot lower back from Medicare or from private insurers for the care that we provide. And so because of that, clinics still have overhead. You have to keep the lights on in order for people to get better. And so if that's the case, because of that, you're going to have to see more patients in order for you to keep the lights on, and maybe not even keep the lights on, just to continue to grow so more people can benefit from your skilled care. And so I guess, what do you think something that's going to have to change? Like, is it going to be a law? Is it going to be is it going to be a change in the system entirely? Like, what do you think is going to have to change in order for maybe physical therapy to be kind of maybe more uniform throughout the US, kind of like how physicians are?
I wish I had the answer to that question, because I'd be making the big bucks right now. But I mean, I think at the bottom line, we just got to start where we're working. Show. I think we have to value ourselves a little bit more. I think sometimes just going into the profession, we can get stuck in that mindset. Okay, like, this is where I'm going to be. This is how much I'm going to make, and this is what I want to do for my patients, but I feel held back. And take your outcomes, start to do your own data, and just show your insurance companies, hey, this is how much money I saved you on this patient this year. They didn't get that surgery, they didn't get the the scope or whatever that their surgeon may have recommended, and we did conservative care, and we're able to postpone that another year or 3 years. And having that data to bring back to insurance companies and show, like, hey, look at the money we're saving you, should hopefully at the end of the day put more money towards the PT world and more preventative care, preventative services. Now, if there was a law at the federal level that could help us with that, that would be pretty great. But with the past year, everyone knows Medicare did some cuts for PT reimbursement, and when Medicare does something, those commercial payers tend to follow suit. So as of the past couple of years, our trend's not going the way that we want it to in terms of reimbursements, and I think that's where we got to start in our local communities, and that cliche grassroots approach to changing where you work, and to eventually using that as a catalyst to change the overall nature of PT across the country.
Yeah, and I think, it sounds malicious, for people listening right now, just because we're talking about like, oh, why aren't we getting paid more? Da 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 da. But in reality, a lot of the time, what that means is that we can provide better care. And like Tyler has said, if we get paid more and we don't have to worry about turning the lights on or worrying about spreading, we can have hour or 45-minute sessions one-on-one with those patients. And generally, those patients get better faster, and they like it more. Like, if sometimes people like being on their own, but if I run over to a patient and say, all right, do this exercise, 20 reps, I'll see you in a minute. And then you run over to somebody else and do the same thing. And then you run over to the other third person that you have for that hour. It doesn't feel like you're being paid attention to all the time. And so, although it does sound like we want to get paid more, and yes, we do want to get paid more, but at the same time, we also want our patients to get better. And I think a product of that would be, if it were easy, if we got reimbursed like we should, perhaps patient care would improve.
Yeah, I think exactly. You're on point with that. Just somehow, we have to prove that ourselves. I think we got to take, as PTs, we got to take accountability on that and say, I don't feel like I should be entitled for this pay, just because. It's like, we got to have that objective data. We got to show, I worked with this patient for X number of hours, and this is the condition they came in with. This is what we prevented. They use this much less medication, this much, they didn't have this surgery this year, and showing that on a, objective data budget sheet, and just give that back to insurance and say, look what we did. And it's because I had the one-on-one time with the patient. We're trying to help individuals build new lifestyle habits. It's not just about decreasing pain and getting them back to their activities and daily living all the time. It's about building a new habit. It's like, okay, you spent 3 hours a week coming to PT on top of your travel time. You were able to dedicate that much time for, say, 8 to 10 visits, and look where it got you. Now take 20 minutes of that and, exercise at a moderate intensity for, 20, 30 minutes a day, and kind of change that, and change your whole lifestyle factors. It not only affects the condition they come in with, but their overall health and well-being. And so if we can help individuals and patients form these new habits that not only take care of the condition they come in with, but improve their cardiovascular system or their mental health or whatever it may be for the rest of their lives, that's a way bigger impact than anything we'll do on a post-op knee replacement or a rotator cuff tear or something like that. Is when we can actually change the individual and their overall lifestyle factors.
Yeah, I think us and even sometimes personal trainers can serve as a great liaison for people who just maybe haven't been exercising as much as they have and changing their lifestyle. And a lot of the time, like even like during like post COVID, I don't know if you saw this in your clinic as well, but like a lot of people just were getting injured because they haven't been working out in how God knows how long, and they just stopped working out because of COVID, and they had to take care of their kids, or, they just wanted to stay in the house because the gyms weren't open or whatever. And so it was kind of weird to see that, this whole entire time during COVID, one of the things that, wasn't promoted was like continue, like stay healthy, get active, and be better, because this is affecting people who are generally have a lot of comorbidities. And I think, again, we need to be very big advocates into changing the way people look at exercise and their health habits.
Yeah, absolutely. I think this, year of the pandemic and these past few months have really shown people what it means to take care of their health. I hope there is a bigger push to, eat better, exercise more, take your vitamins, just take that holistic approach to preventing, yourself from, being locked up and staying inside and just like everybody's kind of been experiencing this year. It's been rough on everybody, right? And so we know exercise helps release endorphins and makes you feel better. And if you're just cooped up, on your Zoom meetings for 8 hours a day in your house, it's not only going to affect your body, but it's going to affect your brain. And we're starting to see a lot of that as things open back up and people, becoming more active, which is amazing to see. But a lot of people, like you said, just saying, I sat inside the past year. I worked at home. I didn't have to even walk to my car and drive to the office anymore. I was doing, 5,000 less steps a day for the past 12 months. And, now I'm trying to get back into running and my knee hurts. So there's a lot that goes into that for sure. And I think it's been a fun experience and challenging experience as a PT to help with not only the physical changes that have happened in the past year, but the mental changes that go along with that.
Yeah. And how have you adapted mentally and physically? I mean, being clinic director now is fantastic, but how have you changed maybe in your treatment style and what you're doing with your patients? Like, are you focusing a lot more on education? Are you really honing in on your skills with manual? Like, what's been changing?
With my treatments, not much has really changed in the clinic. One of the bigger changes we had as a profession and as a company is treating post-COVID patients and trying to learn what some of the impairments were for people that, had to go on a ventilator or, just had the long haul COVID symptoms and, used to be able to run 4 or 5 miles a day, but now when they walk a mile, their O2 sats drop to 90%. And I think those changes as a physical therapist has been challenging just because we don't have the research out right now to support it. So you kind of just go off your best judgment and your physiological expertise. When it comes to personal lifestyle changes, I haven't been to a gym in about a year. Kind of been doing the whole garage gym for myself and trying to keep my mental health sane that way by working out when I can. Uh, and for, I guess, PT, at first everyone was a little hesitant on getting back to manual therapy and having that contact with the patient. Should we put gloves on? We're definitely wearing masks. Are we gowning up to have that close to contact? But we followed the CDC guidelines, kept masks on, kept hygiene. Tried to limit how many patients were in the clinic at one time, which I was fortunate being in one PT clinic. It wasn't super busy. So, spacing out where I can. And I don't think my treatments really changed per se with COVID.
And what kind of symptoms were you seeing? Is it just like general fatigue and malaise, or what were you seeing? Was it anything weird?
I wouldn't say anything weird. I've had a few patients that, most notably, I have a patient. They were in the hospital for about 72 days, and are functioning at about 40%, lung capacity. So, trying to reintroduce exercise and exercise. Now, this individual had been used to exercising prior to COVID, and now that they've had it and are operating at a much less, perfusion rate, ventilation rate, he's got to be able to exercise with a nasal cannula and try to re-educate diaphragmatic breathing. And there's been a lot of interesting impairments that go along with the people that have had more severe cases. As for kind of like the average, COVID case, where maybe it lasted 7 to 10 days or a couple weeks, and just kind of general fatigue or malaise. The biggest thing we're monitoring is just O2 sats, just making sure they're not dropping, below 92%, and trying to keep them working on, diaphragmatic breathing, decreased accessory muscle use, all that fun stuff.
Was that person older that had those, that was in the hospital for that long?
Mid 60s.
Okay.
And active, otherwise healthy individual. So
something about the age, man. It's just like, thankfully, I mean, a lot of people were affected by COVID, but thankfully, it was not that, it sounds bad that thankfully only older people were affected by this, but if rather than it affecting everybody in a severe way, it was only to a less category or a smaller percentage of people that it really, really affected and hospitalized people.
Yeah, it affected all walks of life, and just in the outpatient setting, we don't see it too often. But I've had individuals in their 20s, 30s. Probably the more common ones that are the long haulers, or the more serious conditions are 50s, 60s, 70s with other comorbidities. But there's it just kind of, it's strange. It affects everyone so differently, and there was really no specific pattern other than if you had other comorbidities or age. Obviously, we do know that's certainly plays a big role, but there have been some people that otherwise on paper are healthy and still end up in the hospital. So it's been an interesting year.
Were those people, did they have breathing problems, or they couldn't exercise as much?
Not that I'm aware of. I'd have to maybe go back and look into that and see if they had a history of asthma, or if they were a smoker 20 years ago or something like that.
Yeah, it's very interesting because I just, I keep hearing every now and again, like this post-COVID, like symptoms, and I'm wondering what they are, and I want to know more about it. So it seems like you had a couple patients. I don't know if you knew. I mean, you said you're taking their O2, so I don't know if they're having a harder time like maintaining exercise, or having a harder time breathing, or
most of it's from what I've seen in the clinic, is they're just having a hard time with oxygen perfusion. So like I said, they're that individual that's say 45 years old and was an avid runner, and then got COVID for 2 or 3 weeks. He's going to run his 3 or 4 miles, and by mile 2 he's complaining of shortness of breath. But you look at his breathing rate, relatively normal, but you look at oxygen sats and it's down to 93, 94%, when he's probably used to running at 98, 99%. So just that little change in perfusion rate, and I don't know if that has something to do with red blood cells, or the change in immune function, or I think as the next few years play out, we'll see more research into those areas and why certain individuals were affected more, and why perfusion was so affected too.
Yeah. How have you been staying healthy?
That's a great question. Made a Had a connection and made an investment into a spin bike, and got a Titleist punching bag in the garage. Those are kind of my go-tos, and I got 2 dogs in the house that keep me on my toes. So walking them a couple times a day or running with them, and just trying to get outdoors. Not being back in the gym for well over a year now has been a little bit strange. Not feeling as powerful as I used to be, but still feeling relatively healthy. So probably my workouts look more like body weight training now, more just cardio conditioning, less of the heavy squats, deadlifts, things like that.
You didn't get any of those biker spandex, did you?
There might be a pair hanging up over there. It was a Christmas gift. I'll say that.
Okay. All right. All right. At least you didn't buy it yourself. Did you get
I might buy my own pair. We'll see.
did you get an outdoor bike or is it just stationary?
I had like an outdoor hybrid bike, but this one's just a stationary bike. It's a Kaiser brand. Big fan of Kaiser. If anyone's interested in a spin bike, I highly recommend this. I'm not getting paid for this. It's not a plug by any
No
means,
advertisements here.
But no, it's a great bike, and really been enjoying that. It's been helping probably more with my mental health than my physical health this year.
Yeah. So we talked about it before. You played football. You've always been a really fit person. Mentally, it's got to been draining. But where did your exercise journey kind of start? How long have you been exercising for? Have you always been an active kid?
I guess I've been always pretty active. Starting sports pretty young. I had an older brother that played sports, so I had to keep up with him. And my dad was always into weightlifting. I remember, being 4 or 5 years old, running downstairs. Dad would be throwing around his dumbbells, and I'd want to do that too. So I guess my fitness career journey started probably mostly in middle school, when I began wrestling, and wrestling was, probably been the biggest influence on my fitness and probably my personality as well. I think if there's one sport that really challenges you mentally and physically, wrestling is probably in the top 5 for sure.
Yeah, I've been watching a lot of the combat sports lately, actually, and just getting into the UFC, boxing, and my brother is really huge into wrestling, actually, and he kind of steered me towards that a little bit too. It's such a I mean, it's very physical, but it's also such a mental game too.
Yeah, it's definitely different than, I mean, you played soccer, and I'm not sure what other sports you played, but having a team, it's more, planning on a board, who's going to be where, what this guy can do, what I can't do, just working as a team is totally different than going out and you're the only one competing against your opponent. And it's definitely more of a mental challenge than a true physical challenge at that point, when you're, it's all on you. Just like, I'm sure gymnasts, golfers, bowlers, they all deal with the same thing.
Was your dad and your brother a huge influence on your exercise journey or fitness?
Probably my dad more so with just weightlifting, and him helping coach little league and t-ball growing up, and some of our other sports. And my brother was always taller than me and a little bit more athletic, so I always strive to be a little bit better than him. And he got the height genes, but I got the muscle genes, I guess. So once I started wrestling, I was able to keep up with him.
And now that you haven't been you've been exercising, but have you found it harder to get out in the gym and work out more now that you haven't been in the gym, or is it easier now because you have your equipment at home?
It's easier now for time wise. I don't have to pack my bag and get changed after work, go to the gym, all that stuff. I just kind of come home, take the work clothes off, put the gym clothes on. Usually I walk the dogs as my warm up, and try to use them as motivation and go from there.
Mm-hmm.
Definitely miss going to the gym, to have that external motivation from those around you, and just having all the resources to utilize and different machines and weights, and it just kind of helps you change your workout up a little bit more than just the little investments I've made in the garage. But I think time wise, it's more efficient to just be here in my garage. But some days it's a struggle to, I'll sit out there and stare at my shoes for 10 minutes and, decide whether I'm going to do it or not this day, and see where life takes me.
Yeah, I think it's I think it's good to hear that too, because everyone always thinks if they see a fit person, they're always like, man, I wish I could just be like them, because they're just motivated, they can go out and work out, and it's easy for them. But like, it's not always like that. Like, it's sometimes you just don't feel like working out, and it's never like, oh, can't wait to work out today. Like, after I worked all day, sometimes I don't want to go and work out.
Yeah, I find it easier to work out after I've had, maybe a stressful day at work. So I just need
Mm.
to burn off some of that energy versus, a nice, easy, good day at work, slow day. I come home and I'm like, I just kind of feel like chilling still. So I think the psych component of your work-life balance and your relationships and travel and whatever else you got going on in life has a bigger role in that sense for sure.
How have you motivated patients to stay active?
That's a great question. Just by telling them to do their home exercises. And the biggest thing I always say, as we taper down from, say, a plan of care of 3 times a week to twice a week to once a week, is I just say, hey, you've been dedicating this time to come to the clinic. You're putting your hour in the clinic, your 20 minutes to get ready and get here, and 20 minutes to get home. So take that 2 hours and condense it to 10 minutes. If it's 10 minutes of walking around the block or just getting outside and enjoy being out in the sunshine, or go do some push-ups in the garage, or whatever you got to do. But don't let that time that you dedicated so much to your health and well-being of coming to PT just fade away when you're done. Make sure you're still giving yourself that time. Not only, I'm a big believer in that exercise is more for your mental health than your physical health, but taking that time from PT and trying to transition it into their day-to-day habits.
Yeah, I think it's both. I mean, you get the physical, you do something physical, and you get the endorphins going, and you feel better after, and it's like your brain shuts off for a little while, and it's like, oh my God, finally, I feel so, like, you just feel so much better after. And I feel one of the things I've tried to do is, when I ask patients what their goals are, I try to always relate the exercise back to like their goals, and like be like, listen, if you want to still play with your kids, or like be able to go to the grocery store and pick up stuff, like, you're going to have to work out. And even if it's 2 times a week, 3 times a week, just do it, do it. And is that something that you've done as well? Just like making it intrinsic for them? Because sometimes some people are just like, I'm not going to work out, man. I don't know. Like, it's just that's just built within them. And no matter how many walls you try to break down, or like little tools, sometimes they just don't want to work out. Are you using goals for them to make it intrinsic, or are you just kind of winging it and seeing what's going on? Or
No, I use that as well. It's a great method. Just try to make it relatable to them and what their day-to-day life entails, and why they came to PT in the first place. Most people don't come there just to get out of pain, or just because their knee hurts. They're doing it because they couldn't get down and pick up their daughter or their grandkid, or they couldn't take their dog for a walk that day because their knee hurt so bad, something like that. And just trying to, like you said, use that intrinsic motivation. And I actually had a patient say the other day, and it kind of stuck with me, and he's in his early 70s now. And he said, I retired at 60, and I had all these hopes of, just being done with work and traveling and enjoying life. And now I've had, 3 surgeries over the past 10 years. And he's like, I feel like I've just constantly been in PT. And he goes, he's like, I used to exercise. I was active when I was young, but I just went through this time of my life where work and kids and everything else became more important than my own health. And he kind of put the big picture all into one sentence and just said, I spent all these years working hard to play hard at the end, but he's like, now I'm here working hard in PT, and I don't have time to go travel and do all these things. So trying to take that message personally and find ways to relay that to other patients and say, you're in your 30s, your 40s, and this is a really true time to dedicate, invest in your health now, or you're going to pay for it in your future. I believe there was someone that said that back in like the 1700s. There's a good quote that takes similar words like that, but it's true. If you don't invest now, whether it's, that 20, 30 minutes, 3 times a week or whatever it is, then you're certainly going to pay for it down the road.
Yeah, I get that a lot too, especially with older patients. They're like, I wish I did this 30 years ago or 20 years ago. And I was, for some reason, I've been seeing a lot of correlation with money to exercise. The sooner you start, the better. The sooner you start investing, the sooner you start saving, the better you're going to be off later on. And, even with money, I mean, money has become more, I feel, easier to talk about more recently because I feel like you see all these YouTubers putting out videos of like finance and investing and all this other stuff. And you don't see that as much about exercise. You have people who are influencers, right? They post videos of exercise and stuff, but people don't talk about exercise all that often. Do you feel because it's so personal that it's just not commonplace, or do you feel like it's just, I don't know, just people don't want to talk about their exercise life?
Yeah, I think and another rabbit hole we could go down is the education system. But most of us aren't taught at a young age how important nutrition and exercise is. We're taught how to do math and social studies and sciences and all that good stuff that we need to learn how to learn. But when it comes to taking care of ourselves, in those most formidable years, it's not a big education piece on exercise and nutrition, and nutrition especially, which I think is far more important than exercise. The older I get, and the more the relationship you try to develop with, PTs. I feel like we have a good relationship with exercise. We know what it does. We know why we do it. But a lot of the times, the nutrition part's a struggle for people. And sometimes people say, I exercise because I want to eat more. That's fair. It's a fair trade. But having that both of those education pieces at a younger age, I think would go a lot farther to changing the way we form our habits. And instead of spending trying to focus so hard on getting those grades and spending hours in the library, maybe take 20 minutes of that and go work out and prolong your life a little bit.
Yeah, I completely agree. And with, things are changing rapidly, and who knows, maybe in the next couple of years education is going to get on board and everyone starts exercising. But in regards to PT, where do you feel like the field of PT is going? I think this year with telemedicine things changed a lot. A lot of interesting things are happening with like AI or even genetic testing. Do you feel that PT is going to become even more personal, or do you feel like it's going to become just like telephone visits or telehealth visits rather? Where do you see the profession going? Because for me, I feel like it would be so tough to mimic what a PT does. I mean, it's so personal and very, very human, so to speak. And so maybe in your own words, where do you see the PT field going?
Yeah, I think we're in a safe profession that AI won't be taking over our jobs anytime soon. But
Yeah.
I see us, my hopes and where our vision should be is that we're another primary care provider. I'd like to see, just like your insurance covers, maybe 2 dental cleanings a year. Let's get insurance to just get everybody to go to your local PT, even if it's just once a year, and just say, this is what my schedule looks like. This is what my day-to-day lifestyle is. I got this shoulder pain or this back pain going on. What can you tell me today, in our 45 minutes together, that I can prevent these things from getting worse, so I don't have to come see you for 6 or 10 weeks, whatever it is. And just having those, like an annual or biannual check in with your local PT. And the big thing about that would be getting insurance to pay for it, and just being another primary care and another resource for people to utilize to benefit their health.
Yeah, sooner the better. Sooner the better. Even if it's a twinge, even if you go to the gym and you do a heavy leg day, or you're running and you felt a tweak in your ankle. I mean, the sooner you can get in to talk to somebody and just get on the right path, the better. And the harder it is, it's going to change. The harder it is to change later when you've already developed these motor patterns. You develop, like, your body starts moving in ways that it shouldn't, and you have all these compensations for things that you've done over the past years, and then you come in 20 years later and be like, all right, fix me. It's like, okay, well, it's going to take a little bit of time to fix whatever's going on with you right now. So be patient. But I mean, you should have came in maybe a little while ago.
Yeah, and I think us PTs get that a lot. Probably, at least I'd say at least 50 to 60% of the patients that walk through the door and say, "Oh, I probably should have come here, 3 months ago or last year and really taken care of this, but I just didn't set aside the time for it." And then they wait till it gets to that point where, okay, now I have to do something about it. And sadly, not sadly, but we don't provide overnight results like a ibuprofen would or a cortisone injection or things like that. It takes time for tissue turnover and bodies to adapt and heal, and that's the biggest thing we can educate our patients on day one is, you've been dealing with this for a few months. It's going to take more than just a week or two to really, start to notice a difference. So just be consistent, stick with it, and kind of like the Buffalo Bills coach, trust the process.
Nice, nice. I think it's a great way to end. I think we're getting close to the end here, by the way, and you've been great to talk to. But I think we're going to close out with the last section called "the Health Me to Health You." And so gave the questions ahead of time, but I want to ask you the first question. If you had the attention of everyone in the world for 30 seconds, what would be the one thing you would say?
I think kind of going back to our conversation earlier, I like the one thing I want everyone to know is just invest in your health now. Work on your physical health, your mental health. Be happy and enjoy the moment, and you know don't let the past or the future put you in a position that you can't control.
Second question. If you were given the opportunity to start over at the beginning of college, knowing what you know now, what would you have changed or perhaps done differently?
uh, I would have looked for better student loan interest rates, uh, and maybe I don't think I would have changed much about my courses or my career path. I met a lot of great people along the way. I had a lot of good relationships and mentors, and if there's one thing I would change about the PT route, it'd be being a little bit better with the finances.
I think that's smart. I think everybody can definitely relate to that who's gone through PT school. And I think lastly, for those looking to become a therapist or looking to go into PT school relatively soon, what piece of advice would you give them?
Have great mentors, build relationships, and keep a close group of friends around you that have similar goals and similar interests. It's all about the environment you put yourself in, and making sure you have the support system around you.
Yeah, I think support system's huge. Being with you guys, we always bounce ideas off each other, especially for like homework and stuff or projects. And it was super helpful, I think, in PT school to have a good group of people to bounce ideas off them.
Yep, absolutely.
Cool. Well, listen, Tyler, thank you so much. It's been an hour already, so I don't want to take up too much of your time. I know it's late over there in Tennessee, so I appreciate you taking the time to come on the podcast and share what you know.
Yeah, absolutely, Mike. Thank you for having me, and appreciate our conversation, and look forward to having you come visit Tennessee sometime soon.
Absolutely. I've been seeing pictures, man. I got to get out there soon.